Hi, I'm Aubrey Going, and today we're going to talk about shoulder impingement. Shoulder impingement is a very common pain-producing condition that affects the front and side of the shoulder, what we'd refer to as the anterior-lateral portion of the shoulder. Impingement is literally just pinching or squeezing of the structures between two bones. In this case, we're talking about the shoulder cap or the acromion and the head of the humerus or top of the arm bone. There can be a number of causes for this impingement, this pinching of tissue. The structures involved are going to be primarily either the tendon of one of our rotator cuff muscles called supraspinatus, which travels out from across the top of the scapula, underneath the shoulder cap and attaches onto the outside of our arm bone or humerus. The tendon can become compressed between the two bones, or the bursa that sits above it, but below the shoulder cap, can become compressed or impinged as well. So let's take a look at these structures in the subacromial space. If we zoom into our model here, we'll see the tendon of supraspinatus as it passes just underneath the shoulder cap in this kind of subacromial space. We'll see this here. There's a very limited amount of space between the humeral head at the top of the arm bone and the acromion, the shoulder cap here. And this isn't the only structure that can be impinged here. We said there's also the bursa, which is this small structure here, shown in green. So any of these structures really can be affected. Either the tendon of supraspinatus, where it travels out underneath the acromion, and we can see where the bursa is sitting below. The pain felt from impingement will usually be felt to the outside or around towards the front of the shoulder, the anterior lateral portion, but can extend down the outside of the arm as well. And this is responsible for somewhere between 44 and 65% of cases of people presenting with shoulder pain. So how do these structures become impinged? The space can either narrow between the two bones because of a shifting in the bones, or it can be to do with the tissues themselves or the position of the arm. This condition is very common in repetitive tasks, particularly overhead tasks. So people who are involved in arm-intensive activities where the arms are raised up, reaching over their head in professions like painting or plastering, or sometimes even just doing a little bit of home improvements. So let's look at the intrinsic factors. One of the things that can happen is due to inflammatory processes, the tendon may actually swell and enlarge, and that will reduce space available between those two bones and could cause pinching or crush of these tissues. It could also compress or pinch the bursa, causing a subacromial bursitis. Two other factors exist. One is the position of the humeral head. The humeral head can be raised up in its socket because it has space to travel, and if it is drawn up in the socket, then it can reduce the space between the arm bone and the shoulder cap. The other factor is the angle of the scapula. And this is oftentimes broken down into three grades, where the scapula is described as either grade 1, where it's flat, grade 2, where there's a curve, or grade 3, where it's hooked. If this genetic condition is present, the reduced space makes the client far more likely to suffer impingement symptoms.